Hello and welcome to Community Pulse, a bi-weekly CAN TV program featuring local leaders and organizations focused on improving the health and well-being in the city of Chicago. Community Pulse is presented by Foxglove Alliance, a public health care coalition supported by the Hectone Institute of Medicine in partnership with the Healthcare Council of Chicago, managed by Third Horizon Strategies and Hectone Nurses and Humanities. My name is Tacora Love, one of Community Pulse's rotating co-hosts. I am with the Hectone Nurses and Humanities and AMSN. Today, we are beginning to celebrate and honor awareness of menopause. October is Menopause Awareness, and October 18th is Menopause Awareness Day. So today our featured guest is Dr. Linn, who is a world-renowned menopause specialist. We are very honored to have Dr. Linn here to speak with us about menopause. Dr. Linn, thank you for joining us today.
Well, thank you for inviting me. I'm really thrilled to be here.
Thank you. Can you please tell us a little bit about yourself and why you are so passionate about women's health, specifically menopause?
Well, when I began my professional career during my training, I trained in obstetrics and gynecology, so women's health. And I had an interest in endocrinology, so the hormone systems. Mm-hmm. In the beginning of my career, I was really focused on fertility regulation, so trying to help women have babies when they wanted to, based on some work in contraception and a lot of my clinical activities. And be quite frank, as I aged, my patients aged,
yes.
And I started realizing that women were now transitioning from the prime reproductive time of their life to the post-reproductive time, yes, where hormone changes are occurring naturally. But it didn't necessarily go that well for everybody, and there were a lot of the symptoms associated with it. And I realized that women needed help.
We do. Thank you for that. As we talk about menopause, can you just take a moment to define menopause and just share some common symptoms of menopause for our audience?
Sure. First, I want to establish very, very clearly that menopause is not a disease state. It's a natural phenomenon. And I think historically one of the big challenges is that even in understanding menopause from a scientific perspective, understanding menopause from a clinical perspective, it really wasn't a big issue until late 20th century, early 21st century. And that has a lot to do with women's life expectancy.
Yes.
And so now we have so many women who are my generation, the baby boomers. So literally millions and tens of millions of women
yes,
going through this point in their life when their hormone world changes dramatically. So I'm going to use a term.
Okay.
It's a scientific term, but it's not meant to be a negative term. And that's ovarian failure. So the ovaries, which women are born with, these two little glands,
yep,
become active during puberty, and women cycle. So every month they produce an egg, and roughly 13 times a year, a woman will then either she will become pregnant, or if the pregnancy doesn't occur, she'll have a menstrual period. And during that time, you're producing abundance amount of estrogen and some other hormones. But that's not a forever phenomenon. So what we do know is that eventually a woman will literally run out of eggs. And that is right around on average 50, 52 years of age in the United States. A few years before to a few years after, as egg functioning changes and as they diminish in number, the levels of estrogen changes drastically. And again, the other big hormone is progesterone.
Yes.
And so once the levels drop to a certain point, you may become symptomatic from a variety of things. And probably the most dramatic for many women is the development of what we call hot flushes or hot flashes.
Yes.
the technical term for that is vasomotor symptoms. And it's interesting that if the body never saw estrogen, you would never experience this. So if estrogen levels remain really low. But once you have adequate estrogenization and then you take it away, it comes down, will trigger this response. And it has a lot to do with where our kind of our body's thermostat in the brain. The regulation of it is very close to where the hormone regulation is. And so these signals, will end up, causing changes in the body thermostat. So it's really the inability to tolerate heat. You may provoke a hot flush, but it's really the most common during this period of time. And so that's probably the one symptom that many women will complain about, but not all.
Right.
Okay, not all.
Sorry. Go ahead.
No, well, but the other area is the fact that the tissues of the genital system contract. So the vulva, vagina, are highly estrogenically sensitive. And so during the prime years when a woman has adequate estrogen, those tissues are moist, they're very elastic. You can just imagine during childbearing, the elasticity is a good thing. And women feel normal. But as that estrogen level drops over a period of time, and it's often within 1 year, the tissue thins and becomes inelastic. So now it becomes potentially very sensitive.
Yes.
And that isn't always pleasant. And it could be annoying to a woman in a variety of different ways, from normal toilet hygiene to clearly sexual relations.
Right.
Again, not everyone gets it, but everyone gets the changes.
Yeah, and it's a common symptom. And you're right. We hear a lot about hot flashes. What are some other symptoms that women may experience? In my research, and I'll be very transparent with you, in my research, it's the brain fog, it's the change in, the hair follicles and things like that. And in my research, I'm like, oh my gosh, like I have this, I have this, I have this. And then, of course, I approached the topic of like perimenopause, which we'll get to in a second to talk about the difference. But what are some other symptoms in addition to the hot flashes, which we know are common? But what are some uncommon ones that women, our audience, should know about?
So let me group them in two categories. Okay. Those that cause symptoms, and those that cause changes that the woman would not be aware of.
Yes. Yeah.
So under symptoms, you already touched them. We know that the brain is a highly reactive organ to hormones. And wonderful work has been done at the University of Illinois here in Chicago, where they actually did scans and watched the brain function under different hormone milieu, and it's really kind of well understood. So when women tell me they're having difficulty with the brain fog, or maybe it has to do with mood changes, or possibly due to their memory changes. Yes, these all can happen for other reasons. They may not be exclusive. We should never over attribute that it's hormone.
So true.
But it really should be looked into a little bit. And certainly we can see when we replace estrogen. So we give estrogen back. Often you'll see a reversal of those symptoms. So sleep disorders.
Yes.
Big issue. Now, ironically, those vasomotor symptoms we talked about are worse at night. So when a woman is flushing at night and maybe perspiring, then she's getting chilled, it may wake her. And so now you have sleep interruption, and you do that enough times, the next day is not very pleasant for that woman, which may contribute to the fog, because of fatigue, and things like that. So the other big changes which a woman may not notice are changes in her bone. Because as estrogen levels go down, the bone may start to demineralize. A lot of this is genetics. And there's a whole variety of changes related to calcium leaving the bone that can range from, use terms like osteoporosis, which means the bone is becoming very porous, it's prone to fracture. Osteopenia, which maybe is not as severe. I don't like the term osteopenia because if you translate it really to the roots, it means too few bones.
Too few. Right.
But the point is the bone mass is reducing. And we can see this with scans. And we try to prevent the bones from thinning because once you have osteoporosis, you're at greater risk for fractures.
Right.
And some of these fractures can be very, very, very difficult and can even lead to death and complications. The other area which we're focusing on greatly now is cardiovascular risk.
Yes.
Thank
you for bringing that up.
Yeah, and we know now that the estrogenized woman tends to have a healthier cardiovascular profile than the hypoestrogenic woman. But one of the changes that we can't ignore is getting older.
Yes.
And so it's taken a long time for us to understand, is this just aging or is it really aging and hormone changes?
Right.
But what we've learned, sadly, is that women, as an example, that have their ovarian function fail early. And there are some syndromes that will cause that. So if a woman's 40 years of age or younger and no longer is having periods, that needs to be looked into.
It needs to, no.
Okay.
So,
or surgical.
Yes.
So if we remove the ovaries, and we now know it's not a good idea to remove them unless there's a good reason. Because now our studies are coming out showing that we actually affect the length of life. And so women who retain their ovarian function longer have a greater life expectancy and have fewer heart attacks, strokes. All that's kind of coming to a head right now because it's been confusing to us scientifically.
Yeah. No, and you mentioned the age, which leads us into the next question. What's the difference between perimenopause, because we're really starting to hear a lot about that now, and menopause?
It's a great question. Menopause is, there's an absolute definition. It's 12 months without a period at the appropriate age. So when a woman misses her first period and she comes to me and doctor, am I in the menopause? I'll say, we got to wait. Okay, if you have no period for 12 months, then I'll tell you yes. But if your period starts and stops, and you're in this time frame, which may be years, where you're going through this transition from regular ovulation to no ovulation. That is what we call the perimenopause.
Okay.
And we tried to characterize it, and we don't do a good job, but one definition is 5 years before and up to 2 years after the final menstrual period.
Can be a very long time. Okay. Well, that's very good for our audience to know the difference between the two. One of the other questions that I have, because after talking with several women, I found out that many women are apprehensive or they're embarrassed to discuss menopause or menopause-related symptoms with their physician or healthcare provider. What suggestions do you have or advice would you share with our audience?
Well, technically, you shouldn't be embarrassed about this. This is a natural transition. I think where it gets a little indelicate, is when a woman wants to bring up sexual dysfunction. Because this is where it gets really complicated. If a woman's having painful intercourse, she may choose to avoid intercourse, which may start leading to issues with partners, relationships, which can be quite painful, and it's an area maybe the woman feels vulnerable, doesn't want to start exploring. And so I think it should be approached gently. I'm hoping doctors are much more proactive in asking these questions. I'm not so sure that that's the case, but that women do not feel that they should hide from this, and they should talk about it. Similarly, if a woman is experiencing these body changes, and these hot flushes or the brain issues that we had talked about, say, look, I'm experiencing this. I want to understand a little bit more about it. That's usually the first step, is to understand it, because
that's good advice.
Because a woman can be very accepting, knowing that this is happening. It's a
Yes.
natural phenomenon, and I want to talk about it and learn more about it. If a woman is very symptomatic, then what can be done to alleviate my symptoms? And the last thing I want to point out is use this time as kind of a signal. My body's changing, and some of those changes have long-term implications, like the bone health, cardiac health. And are there any other things that I need to be concerned about so I have a nice, normal, long, healthy life?
Yeah, no, that's very good advice. And, I think our audience, women, like, we need to hear that. I love how you pointed out. It is a natural progression of aging. It is absolutely nothing to be ashamed about. And we should seek help and seek to talk to our provider, for next steps. You mentioned treatment. What are some treatment options, for menopause? And how long do the symptoms, typically last? Like, one of the women I spoke with said, how do I get relief, from these symptoms?
So if we talk about vasomotor symptoms, the hot flushing, interestingly, and there's an ongoing, very large study being done over the last few decades, looking at different ethnicities.
Yes.
And so looking at different genetic patterns, and women of different ethnic groups or different colors, so to speak, have different lengths of symptoms.
So true.
And African American women, as an example, tend to have the longest duration of symptoms, and it could be 12 years. So
help!
it's where you actually be experiencing it. Asian women, shorter period of time. White women and Hispanics, somewhere in the middle. And so it's just not like, well, I'll wait it out and it'll get a little better. But again, it really depends on how one perceives it and how one reacts to it too. I've had patients that it interfered with their ability to function. And other women who just kind of said, I'm having my personal summer.
I hear that a lot. I definitely hear that.
And kind of joke about it.
Right.
Or they even pull out fans. And so they have a different way of looking at it. So for me as a clinician, the question is, how bad is it bothering you? And I'll give you a range of ideas on what we can try to do. And maybe simple lifestyle changes. Because if you get down to it, you lose the ability to tolerate changes in heat. Okay?
No, yeah, true.
So, as I explained to a woman, let's say it's wintertime and you're all bundled up. And you got your, multiple layers, of all the, down and everything.
For those Chicago winters.
You walk into a department store, okay?
Start taking it.
Take it off. Because if you walk into a warm environment, you're going to get hot and your body's going to react. Now with that gentle raising of you and try to, remember, we sweat to keep our body temperature lower.
Yes.
It's going to go like from 0 to 100 really fast.
Yeah.
So all of a sudden you're going to be perspiring and flushing, and it may make you uncomfortable. So you have to anticipate that. Same thing in hot weather, how you dress. Layers in the winter, okay? To be able to put on if you're getting cold and take off, and a similar strategy, in the summertime. Controlled breathing, diaphragmatic breathing, slowly relaxing. These are what we call lifestyle changes.
Yes.
People that drink a lot of caffeine, as an example,
Guilty.
They're more susceptible to these changes. 'Cause we're talking about these are blood vessels that are opening and closing. So maybe you have to cut back in that area. Everyone has their own ways of dealing with it. If that doesn't work, there are certain medications that could be used, but quite frankly, the most effective medication is estrogen treatment, of giving back the hormone that your body is no longer making. And actually, it does some positive things too. So I was always very aggressive in suggesting estrogen treatment because it's going to help your bones. It's going to help your cardiovascular profile if done physiologically. We're not talking about super crazy doses, that are beyond what the body needs. We're talking about trying to, give the body back,
find the right balance.
Yeah, and but estrogen scares people.
It does. It does.
So that becomes a little bit more of a discussion, more of an education perspective. And quite frankly, things were made worse for us in the medical community because a really monumental study was done in the late 90s, and all the data came out in like 2002, and the study scared everybody. Now we know that it was kind of analyzed poorly. It was designed poorly. And additional analysis have shown that estrogen can be beneficial as well as not as dangerous as we thought.
Yeah, as we begin to wrap up, I have just two important questions, I should say. Can we women prepare ourselves for menopause? If so, what healthy lifestyle changes can we implement?
Well, I would say the first thing is to learn about menopause.
Yeah. Very good.
So go to a reliable source. I'll suggest a website which used to be called the North American Menopause Society. It's now called Menopause Society. It's a wonderful organization, menopause.org. And read about it and learn about it so you're not frightened of this. I think that's the first thing. Secondly, is having the normal hygienic lifestyle that we wish.
Should. Yes.
Yeah, and maintain good body weight, exercise, good nutrition, because I say all these other issues may be benefited too, by that.
Good. Well, I think you also included my last question, which was what are some key points that you would like for our audience to remember from our talk today?
To me, the most important thing is there is no reason you have to tough this out or suffer through it. If you're having vulvovaginal changes, genital changes, we can take care of that. And it may be something you need to do the rest of your life, but we can make you comfortable and make you function the way you want to function. Similarly, we have strategies to deal with hot flashes, and it's not all hormone. There are other medications that can be tried depending on your personal situation and your health. But you need to engage your healthcare providers in this discussion and make sure.
Very good point.
And make sure that they are willing to talk to you about it.
Yes, no, all very good points. It is time to wrap up. I feel like we can keep going about this discussion, but I would like to once again thank Dr. Edward Linn for his time and for sharing his knowledge and expertise. I would also like to thank CAN TV's nonprofit service team for their support in the production of this program. My name is Tacora Love. Thank you for watching Community Pulse, which airs on CAN TV, Channel 21, or is also available for streaming on cantv.org. Have a wonderful day. Thank you.